Imagine breaking a bone, and the entire treatment is done in just 3 minutes. No steel plates, no screws, no second surgery. This is what a medical team in China promises with their breakthrough called Bone 02, also known as the new bone glue. Traditionally, fixing fractures requires a large surgical incision, placing metal plates and screws, and often a long time in the operating room. On top of that, patients sometimes need a second surgery to remove these implants after healing. All of this comes with risk of infection and complications. The idea came from Dr. Lin Xianfeng of Sir Runrun Shaw Hospital in Zhejiang Province, when he observed how oysters stick firmly to underwater bridges despite water flow. He asked himself, if oysters can stick in wet environments, why can't bone glue work inside the human body, even in the presence of blood? That was the inspiration for Bone 02. Bone 02 is a special blend of organic and inorganic materials designed to be biocompatible and gradually absorbed by the body during bone healing. This eliminates the need for a second surgery to remove implants. Lab tests showed tensile strength over 400 pounds, shear strength around 0.5 megapascals, compressive strength about 10 megapascals. So far, Bone 02 has been tested on over 150 patients in multi-center studies in China, with impressive results in terms of safety and effectiveness. One case, a young worker suffered a comminuted wrist fracture. Instead of a large incision with plates and screws, surgeons made a small cut, just 2-3 centimeters, applied Bone 02, and stabilized the fracture in about 3 minutes. After 3 months of follow-up, his wrist function had almost fully recovered. The glue is completely absorbed within about 6 months, while the bone heals naturally, sparing the patient another surgery. However, some challenges remain. Full details are not yet published in peer-reviewed journals, so international scientific validation is still needed. It's unclear which fractures it works best for: small bones, large bones, near joints. More studies are required. Costs, medical regulations, and international approval will all play a role in how widely this innovation spreads. Bone 02 could mark the start of a new era in bone treatment. Faster, less painful, minimally invasive, and life-changing for millions of patients, if all the promises hold true. The big question remains, when will it be available worldwide?